thank you for coming to the Foreign Correspondents Club to talk about bird flu on a Thursday night. We appreciate it. My name's Sarah Newey, and I'm a correspondent for The Telegraph. I specialise in global health security. And so, as you know, we're here to talk about bird flu. I'll introduce our excellent panel, who are going to be virtual and in the room in a moment. But I just wanted to share a few reflections to set up this conversation before we get started. I've been based here for 2.5 years, and for someone interested in global health, I moved at a very opportune time, because it was about 2.5 years ago that Cambodia saw a resurgence of bird flu. The country had seen a spate of infections back in 2005 to 2014, but then the virus disappeared for a decade in people. So unsurprisingly, in early 2023, there was significant concern when we saw a spike in cases. And that spike hasn't gone away. That year, there were 6 cases and 4 deaths. The following year, 10 cases and 2 fatalities. And so far this year, Cambodia has detected 16 cases in people. 8 of those people have died. So I think it's really important when we're talking about disease to think about the people. Earlier this year, I was in Cambodia, actually with Eric, who is on the screen. And I went and met a family in Kratie province, a few hours away from Phnom Penh, whose 3-year-old son had died from bird flu. His family had backyard chickens. One of them died, and they turned that into a chicken curry. Now, it's not 100% clear if that's the reason that this little boy died, but his dad won't stop blaming himself. He was feverish for a week after he had that curry, and he ended up dying in hospital. When we were there in May, the gravestone was very fresh, having been built just 2 months before. You could see it from their family porch. So this is a disease with a high fatality rate that can be devastating for families and also have a huge economic toll. When outbreak is detected in birds, they all get culled, and for many people, this has huge socio-economic impacts. Of course, Cambodia isn't the only country affected. There have been more than 890 cases across the world since 2003. And recent events in the US have also raised alarm. It's circulating widely in cattle there. So, why is this happening? Why is Cambodia a hotspot, and what's the risk in Thailand and Southeast Asia more broadly? Experts have repeatedly said the next pandemic could be influenza. Is bird flu that pandemic? To answer those questions, we have 3 panelists with us today. First, I'll start with Dr. Bolutaya Parisan. I'm so sorry, I'm bad at pronouncing your surname. But Bolutaya is an animal health officer based here in Bangkok for the World Organization for Animal Health. Then joining us, I think, from Singapore tonight is Eric Carlson. He's the head of the virology unit at the Institute of Pasteur Cambodge in Phnom Penh. And we also have Dr. Lee Sovan, who is the director of Cambodia's Communicable Disease Control Department, based at the Ministry of Health. So I think that's quite enough for me from the moment. I want to dive into questions. We're going to start with Dr. Sovan, just on some of the basics, because I know not everyone here is a bird flu expert. Sovan, could you tell us a little bit about how bird flu symptoms are different to general flu, if at all, how the disease is treated, and what we know about why there's a high fatality rate?
Yes, thank you, and thanks for the opportunity to join this panel. And I think this question is a really interesting question, and also very difficult to differentiate between the bird flu and the common flu or seasonal flu. What is different, make sure that the health worker could ask the history or contact of the chicken die or duck sick or die or wildlife. So that's why that we could detect it by our clinician when they see the patient with pneumonia or respiratory symptom. We'll ask the question on the history of contact, or have the poultry sick or die in the community. And I will say that we finished our outbreak of bird flu in year 2014, and we have the peacetime from 2015 until 2022. And then it started to take again in 2023, as you mentioned about the data that I don't want to say again. And I would say also that we don't have the different surveillance system. We are the same. Since 2015 until 23 finally again, and our system are the same. But interestingly, that we could consider that this re-emerge of the H1N1 come back to Cambodia into our region, not just Cambodia, I would say. Thank you.
Thank you, Sovan. And on that point, Eric, let's turn to you. You do a lot of work understanding the virology of bird flu. Could you tell us a bit about the strain circulating in Cambodia now compared to the rest of the world? And also, do we have any sense of why the country is seeing spillovers at this point in time?
So, this is a bit nerdy virology, right? But so there's different clades of H5 that circulate around the world. Probably what you've heard the most about that's gone from, all the way from Russia to Europe to the North America and then back again to Asia and things like that is a clade called 2344B. That's what's also caused cow flu in the US. It's caused a sheep infection. It's caused a couple of human infections. It's gone down to South America. It's gone to Antarctica. That is not what is circulating here in the region. We've had an endemic, a high circulation of H5 in the region, for over 2 decades, since 2005. And that's been changing slowly over time with some major changes as well. Right now, what's circulating in Cambodia and the rest of the greater Mekong subregion, so places like Vietnam, Laos, is what is a clade called 2321E, okay? And that has circulated for the past decade. But what has happened recently, back in 2023 and over time, is that this virus has reassorted. And what that means is basically, imagine a bowl of M&Ms, right? One color of M&Ms and another bowl of another color of M&Ms. And you mix them all together, and then you choose out 8 M&Ms. And basically flu as a segmented genome, you can choose out 8 M&Ms and have a viable virus. So we have a mixed color sort of virus that's here now that looks like the virus we had on the outside, but inside it looks a lot different. And this is what's circulating at the current time and causing infections. And we're still trying to understand what the changes are in this virus that are actually causing any issues in the region.
And I'm right, Eric, that we don't exactly know why spillovers are happening so much now, but could you tell us a bit about the different hypotheses that you and others are thinking about?
There's a lot of reasons why spillover can occur, right? So first of all, it can be the virus itself. Again, we don't know enough about the virus to pinpoint that. It could be, other issues in the region with poultry value chains, socioeconomics, even changes in wild bird migration because of climate change. There's a number of different factors that can contribute to spillover that all come together sort of in a perfect storm and cause infection.
Thank you. So, Bolatuya, thinking about how we then control the virus, in a country where backyard farming is so prevalent as Cambodia, what are the strategies that can be put in place to limit the spread in both birds and people?
Thank you, Rebecca, for your question. Can you hear me? Yeah. It's very difficult to look at the screen and looking at you, but anyway, thanks, Eric and so on, and good to see you again. And just looking at this backyard farm, if you think about the backyard farm and chicken, and I would say there is quite limitation of the biosecurity. That's the number one issue, because backyard farm, if you look at these Southeast Asian countries, that's the chicken live in this house, and also it's the part of the livelihood, and it's easily to access, easily to contact or interact with the wild birds and the ducks and geese, because those birds are main carrier of the virus, and we call it reservoir, and that's maybe one reason. And another one is why I'm just saying the biosecurity is because chicken, backyard chicken is very easy also to access and interact with the family members. And if you look at then kids are playing or they just, they're running in the kitchen, and that's the very close interaction. That's why they have this infection. That's the issue is a bit complex of the biosecurity. It's very, it is challenging to implement the proper biosecurity in backyard farms. And also we do understand that we talk a lot about the farmers' education and awareness, but it's really need a lot of efforts of not only farmers, but other stakeholders like veterinarians and community animal health workers who are working in the field, local authorities, and we need a lot of effort for the communication, good communication, giving the good message to them, and coordination for the response, and also the early detection. And it's very important sensitivity of the surveillance. If we detect earlier, if we can capture this sick bird earlier, we can prevent for the infection for kids and the people.
Which leads me perfectly to my next question for Dr. Sovan. For context, when I met Dr. Sovan in Cambodia earlier this year, we met in his office, and he had so many mobile phones on his table. It was quite remarkable. So Sovan, I really want you to tell everyone why you have so many phones and why that your mobile phones are an important part of Cambodia's surveillance system, as well as giving people a sense of what the country does to keep an eye on human infections of bird flu.
Yes, I use this mobile phone, I would say that since almost 20 years ago. And even the Washington Post me about that. The man could save the world with salary $35 with the 3 mobile phones during that time. I say in the year 2004, 2005. I tried to find this article again, but I don't know, lost somewhere. I searched to the Washington Post, so I did not see again. Yeah, because when I was junior, that I just thinking that for the outbreak disease, we could not detect based on the database at all. If you depend on the data sent to your system very late, too late. So that's why that I changed from database surveillance, or we call indicator-based surveillance. But for me, I call traditional surveillance. It means that expired surveillance for the detection or outbreak. So that I changed from depend on the database to the event-based surveillance or information-based surveillance. Means that we need to collect any information from public, from clinicians, from any stakeholder, from sentinel, any sentinel sites, including human or animal, everything that could access the information to me or to my staff in the CDC department, so that we could access, and then we could respond for the early detection and early response. So that as I'm a director of CDC, my job is more about get information first, because I'm responsible for design on the financial release to support my staff, and also responsible for logistic support to my staff. So that I had to responsible, and my direct response by myself as director for the decision. So that's why that we get a lot of information, especially from the clinicians. When I was junior, also when I visited in a hospital, I saw one patient with highly suspected or communicable disease. And then I recommend him to send a sample to test. And then he replied to me, say, yes, I should send that patient sample to the lab to test. But finally, he replied to me again, no, 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 I don't want to send. I said, why you don't want to send? Because it really disturbed me. When you ask me to send, I will need to write a letter to request the chief of my board. And then the chief of my board have to write a request to the hospital director. And hospital director have to write a letter to the provincial health director. And provincial health director have to write a request to the CDC, my department. And my department had to write a letter to the laboratory to test. So it's better I don't want to request it. Don't do it. You know. So I know this surveillance and response system that the hierarchy and bureaucracy is one of the obstacles that we could not stop the source of outbreak. So that's why I reformed the system that I not required when I was nominated as director of CDC. From that, I go to the post of CDC. I'm not required anyone send me the official letter. You just send me the text, understand, that's official. Even Eric here, you know that Eric sit there, sit in the Zoom. He could send me any time of his information or any suspect sent to me, consider as official. Why I need to use the official, even unofficial information? Because when you can talk official, mean that you could release financial support and logistic support to our staff to encourage to work anytime, day, night, holiday.
I think that's such a good point, isn't it? The foundations of public health are not built on bureaucratic letters jumping between different departments, but really rapid information, which is exactly what Dr. Sovan's team are doing in Cambodia. There's more exciting work going on in Cambodia as well, though, which Eric is going to tell us about. He's part of a team that's using very experimental approaches to track diseases like H5N1 from drones to remote-controlled cars. So, Eric, could you tell us a little bit about your surveillance technique in the air sampling, etc., that you're doing, and why that is an important part of this puzzle?
So, just going back to what Savan said first, if you don't mind, the rapidity, the speed at which we can respond in Cambodia is absolutely critical. And, once samples hit the national lab and my lab, we can sequence within, 12 hours, one day. That allows us to then give Dr. Savan and others information about what's going on. We get poultry samples associated with the cases. We can understand genetically, that these are spillover cases. There's no human-to-human transmission. And having this rapid sequencing and communication channel really allows us to quickly inform Dr. Savan and the government and everyone that, of course, these are critical spillover events, but that we're not yet facing any kind of human-to-human transmission or anything like that. So I'd like to say that, technology like Dr. Savan is using, technology in my laboratory is critical for responding very quickly. And the faster we can respond means the faster we're taking care of a problem, the faster we're not going to have an outbreak. But it also saves money, it saves time, it saves everyone their livelihood. And so we're also trying to do things like improved surveillance. Traditional surveillance practices around the world really involve swabbing millions and millions of birds and other animals, looking for a lot of diseases and things like that. But you've probably heard of things like wastewater surveillance and environmental surveillance. And so really using things like environmental surveillance, air, surfaces, water, the ability to really get an idea of what's happening in an area, somewhere like a live bird market or a farm, and then make quick decisions on the ground. We have field forward laboratories that allow us to test things in 5 hours, or things on our mobile phones that allow us to do PCR, rapid tests, and then really being able to collect samples from a large amount of areas, test where those viruses actually are, and then we can go in with our traditional practices and get those viruses and then genetically sequence them. And that information really feeds into all the information that we give Dr. Savan and the government, as well as everyone in the region and globally, on the genetics of these viruses, how they're spreading, where they came from, and it all feeds back into itself, into your vaccines and antivirals and everything else.
And I do think we should just stress what that actually looks like. The air samplers, some of the ones that Eric's team use, involve some really portable, like a mobile phone, some really big, that they carry into these live bird markets, leave running for a few hours, and it gives them a huge impression of what's in the air. Much more, you're detecting much more than you would be detecting if you had to swab all of the birds at that time, right?
Correct. So, when you go in to do traditional surveillance, you're looking at 20 to 40 birds at one time. You can imagine if there's 10,000 birds going through that market at any given time, you're going to miss things, right? Versus if we do air sampling for 2 hours, we can identify pretty much everything that's going on in that market, including things that we missed. And if we do metagenomics on that, we can get not only bird viruses, but also human viruses, other viruses from domestic animals and things like that, and environmental contaminants that can really tell us a lot about what's going on in that market environment.
Eric, I'm going to stay with you for a moment longer, sorry. But can we just talk a little bit about, you've made the good point that there's not yet human-to-human transmission in Cambodia. That's really not something we've seen. Why then are we so concerned about the continued spillover? What opportunities does that give the virus? And what is the risk level across Cambodia and Southeast Asia more broadly at the moment?
What we have to remember about influenza and most RNA viruses is that they're particularly promiscuous, right? They like to mutate, they like to change, they like to, evolve over time. That's why you have to get a seasonal flu shot every year, because flu mutates very rapidly. It can go through things called drift, which is very slow changes over time. The length of the flu genome is actually just long enough that you'll have a mutation every time it replicates. So it's constantly going through evolution to try to change, to make itself better, to get around the things that we have. And then we have something called shift, which is when that virus reassorts. It's that M&M kind of analogy where it grabs different genes from different flu viruses. If you have 2 viruses infect the same bird, it'll grab different genes from all those things. This is how the 2009 pandemic occurred, right? You had different viruses infecting a pig that evolved into a global pandemic. So we're constantly watching these things with influenza, and it's something we have to be concerned about. I don't think that we should pinpoint Southeast Asia as potentially a hotspot. I mean, this could happen anywhere in the world. No one expected, the 2009 pandemic to come from Latin America. There's lots of these viruses circulating all over the globe, including North America, South America, Asia, Europe. So I think we just need a global surveillance system of these things, and to be able to monitor those particular changes that we know that potentially make them more mammalian transmissible, right? So more able to go from a mammal to mammal. And every time it spills over into a mammal, that's going to make the chances greater, whether that be a human or a dolphin or a dog, right? It's going to make the chances greater that the virus is going to develop the small changes it needs to become more of a mammal-to-mammal transmissible virus.
Thank you. Back to the room for a second. Volatuya, I'm coming to you.
Yes.
One thing that's often talked about in terms of bird flu is vaccination. You're an expert in the animal health side. Could you tell us a little bit about the pros and cons of vaccinating poultry and why some countries decide not to do it?
Oh, well, yes, thanks for the question. Actually, it's very difficult to answer that
Give it your best
question.
shot.
Yes, as we already, discussing about this HPAI, we call it highly pathogenic avian influenza, last 2 decades, and the vaccination was very controversial issue, and there was a lot of discussions. However, as you know, that World Organization for Animal Health, we are just setting the standards, and also we recommend these countries to use this our terrestrial animal health code. And in the code on the avian influenza chapter, actually the vaccination is there I would say, but we recommend that vaccination should be part of the control strategy. It shouldn't be stand-alone the strategy, because it cannot, to control the circulation of the virus itself. And that's why as I already said earlier, the biosecurity remains really high importance. And also, if countries want to use the vaccination, shouldn't be a part of the vaccination. Maybe they can combine. They improve their biosecurity, or like quarantine or animal movement control. It is a complex of these control measures should be in place. And I would say there's some examples of the countries, because 3 weeks back we had some conference for the avian influenza in Asia Pacific countries. And looking at the Southeast Asia, nowadays Vietnam and Indonesia, they're using this vaccine strategy. China, one of these, using this vaccination quite long time, I would say maybe more than 15 or 20 years. And also learned that if you look at the news, that France is already started vaccination ducks, and some other countries, as example Netherlands, I had the discussions, and they just start to thinking about vaccinate, but it's the planning stage for the negotiation, the stakeholders, because it's important to acceptance of the farmers. However, some countries, they prefer to have this stamping out, not vaccinations low, like Japan and Korea and some other European countries. And that's what really depends on these country resources, and also how they want to control the circulation or this disease in the local context. And however, just vaccination is, of course, or should be the part of that. Yeah.
And can you tell us a little bit about, so some countries decide not to vaccinate for all sorts of reasons, including trade. Can you tell us a bit about how the vaccines work, and in terms of it doesn't completely get rid of it, you don't know where it's circulating, etc. Like, why do some countries not vaccinate their birds? To the lay audience, it seems like a no-brainer. Use a vaccine and mean the birds aren't sick.
Yes, I forgot to answer the process. Sorry, and I'm very nervous. I forget the questions. Yes, that's right. Actually, this vaccination, they have, of course, the advantage. Of course, they will reduce this infection and outbreaks, and also they would have the lower shedding. I mean, that means we don't see as much just infected chicken. And other thing is trade barriers, and there's a lot of countries, they have its own rules. If they vaccinated poultry, they just stop to import use these countries, they use vaccination. Then for technical, I would say also, if you use the mass vaccination, there is the risk of this. We call it masking. Masking means we wear the mask and we don't know what's to happen, Like that means they depress the clinical signs. That means maybe the detection and the surveillance of sensitivity will be dropped. That's also the another concern. Some countries prefer to have the stamping out or culling all chickens and put these very restrict measures.
It's an interesting debate. Should you cull or should you vaccinate? So Van, I want to come back to you. What do you think other countries can learn from Cambodia's experience tackling bird flu and the systems that you've created during your tenure as the director of the CDC?
What I'm thinking is that we are now could not delay our pandemic. When I was junior, when I learned from my lecturer, they mentioned that the pandemic will happen every 30 to 40 years. But you see, in our lifetime, the pandemic happened more shorter and more frequent. Like SARS outbreak in 2003, then we have the pig flu. Yeah, we have pig flu pandemic H1N1 in 2009, and then again after 6 years, and then after 10 years, we had a new coronavirus, 2019. And then I hope that there will be a 2029, next 10 years, another pandemic, if we are not changed. If all member countries don't change their surveillance system and more focus on information-based surveillance and try to cut down about the bureaucracy and hierarchy, and also the transparency. I would say that even how good are you support, because you see in from 2003 in SARS, our world and developing country have support a lot of funding, billion US dollars. But we could see that could not delay the pandemic, even short term. Mean that we are not on the right track of the issue. I mentioned again, it's about the base, they still focus on the database surveillance, still focus on the hiding the information, still difficulty of the release of emergency logistic support and emergency financial mechanism support. So even if we are not changing all of what I just said, even how good of your build a very good capacity of laboratory, epidemiologists, good logistics, I don't think it will work. Have to change. And I really, all the country learn from Cambodia.
I think
experience. Yeah, about Cambodia experience that if we could do it, what I'm saying, then our next pandemic is not 2029. I guarantee you, if everybody like Eric mentioned, H5N1 is not just in Cambodia or just in our region, it's worldwide. But just they don't have the capacity to detect, or maybe they detect but they don't share. So our pandemic of SARS, COVID-19, you will see already the country that have the disease is very high capacity of laboratory, human capacity, even the finance is very high. But why we could not work together, close together to delay our pandemic. So this we have to check our world. Thank you.
I'd like to share an insight from a conversation as well that we had when we met back in May, which is, I don't know if anyone's heard of the 717 approach, which is an international idea where you detect an outbreak within 7 days, you notify within 1 day, and then you start your response within 7 more days. And Cambodia has actually been one of the pilot countries doing a lot of work on this. And it speaks to a lot of what Sovan's been talking about the importance of really rapid information, taking that from all sorts of places, whether it's pesky journalists asking questions about something rogue happening in a hospital, or a nurse who's seen something surprising. So that's a good way as well of thinking about the initiatives that Cambodia's been taking. But talking of initiatives, I want to go back to Eric. He mentioned a word that I certainly didn't know what it meant when he first told me about it, metagenomics. I'm sure many of you don't know what that means in this room either. I'm sure many of you do, because you're probably smarter than me. But can you tell us a bit more about what that means, Eric? And you're doing a lot of workshops around this across the region. So tell us a little bit about how other countries are learning from what you're doing in Phnom Penh, and how that's helping Southeast Asia be better prepared to detect strange things happening.
Sure. So just like any technology, our ability to detect viruses has grown exponentially. So, we've broken Moore's law, basically saying that, things double every X number of years. We're moving super fast with technology. And that includes our ability to detect not only your common pathogens, things that cause the common cold, human seasonal influenza, RSV, things that generally make people sick, but also zoonotic spillovers and things like that. So when we talk about metagenomics, What we're talking about is taking a sample, whether that be air or water or someone's nasal swab or a swab from a rodent or a bird or a bat, and being able to sequence everything in that sample, that potentially the virus or another pathogen, and actually understand what is going on. So we can do this now, in a very short amount of time, and actually get a lot of information very quickly. It is not, let's be clear, it is not a diagnostic test. Like if you go to a doctor or something like that and say, I want to be tested for flu or something like that, there are standard diagnostic tests that are validated and clinically relevant for that. If we're doing research, we can look for a lot more things, which we then have to go back and validate with those gold standard tests that are, approved and acceptable. But metagenomics really is the future of being able to understand what's going on. And clinics are adopting this, research facilities are adopting this, and using that data will be critical for Dr. Saban and other places like, Centers for Disease Control and things like that to understand what may be happening in their region as well.
And how does the work on bird flu also feed into helping prepare for other diseases?
In what regard?
Well, does it at all?
If you can be,
does
if
it
you
at
can
all?
be a bit more
Does
specific.
expanding these surveillance systems for H5N1 also mean that we're more likely to be able to detect a coronavirus or anything else that affects humans?
Any increase in your surveillance system, any increase in response, any person like Saban who leads a very, very responsive, outbreak investigation and responsiveness is going to increase your ability to detect unknown pathogens, right? So it really requires the laboratory, it requires people in the field, it requires people above us to make decisions and to make good calls about what's going on. And then if we move rapidly, every second that we can get ahead of things, obviously the better it is. So metagenomics, using other types of investigation and then confirming those with our standard assays is a really good way to get ahead of these novel things. Because, anything can cause a fever, anything can cause sniffles or cough. But if we can't detect what it is by our traditional methods, then we need to go to something else that's equally as rapid. And so employing these novel techniques is really going to be critical in the future to get ahead of potential outbreaks. And then feeding that data into, Dr. Saban's system and other places where we can rapidly communicate that information and they can act on it is going to be equally as important as well.
Thank you. Bolatuya, we've talked a bit about the international level, but Eric mentioned it as well earlier. Bird flu has been circulating more in mammals, including cattle. From the perspective of the World Organization of Animal Health and your years working with animals as a veterinarian, how does this change the risk profile around the globe, and how concerned are you about, bird flu circulating in cattle, etc.?
Thanks for that question. Yeah, that's right. Actually, I'm vet, working for more than 20 years, and from the book I've learned that avian influenza that's just only affect the birds. That's the traditional knowledge which we had. But looking at this nowadays, you can see that that is the virus we can see in USA. They have cow-to-cow and infection already that Eric already mentioned about how the virus is mutating very quickly and changing the host like dogs, cats, and lion and sea animals. We can detect this H5N1 and others highly pathogenic avian influenza. That's quite challenging us now. We have to think about this. Our risk files are changing, and we have to be really need more research and how we can prevent such a mutation and change in the host. And when they change in the host, Eric already explained, it's the more adapted different species and it's become the more virulent. That means also the very high risk from us, and we are working on that. And recently, actually, in collaboration with the FIO, there was working on the global strategy, and it's already approved. And global strategy mainly focus on surveillance, early detection, and also how we can all international organizations, research and collaborating centers, whoever is work together to get prepared for the next pandemic, if who knows. And but anyway, that's the maybe my answer, because now we have the global level. We already approved the strategy, and now we are working how we can implement the strategy in all our members in these countries.
Okay, thank you. You mentioned the FAO there. I actually had an oversight earlier. Philip from the FAO was meant to be here, but unfortunately at the last moment, unforeseen circumstances meant he could not attend, which is a shame. But I'm actually going to throw it open to the audience for some questions next. I'm sure you've all got lots to quiz our experts. When you ask the question, if you could tell us who you are, and if there's someone specific who you'd like to target a question to, please do.
Hello. I'm Miley. I'm a freelance visual journalist. Sarah, the story that you told us at the beginning to introduce this fantastic panel really struck with me. And this is a question for you, or maybe also other panelists. I was wondering what treatment that the child received, considering the very high fatality rate, and what the treatments are for bird flu that are currently being explored.
Well, I'm sure Sovan might want to jump in, but just from speaking to his family, at the hospital they gave him Tamiflu, which is what you'd also have for human infections. But the little boy first went to see like a community doctor, almost like a witch doctor, I guess, who tried to extract fluid from the little boy. Quite a traditional thing that happens. I'm sure Sovan can talk about it as well. So it was a few days delayed before he actually went to hospital, and the problem was by the time he got there, he was just too sick for the doctors to do much about. His family said he went into a coma very quickly and never woke up. But Sovan, do you have anything to add about how people in Cambodia are treated for bird flu?
I think the high fatality rate, number one, is because of the virus itself. It could make the patient develop to the severe. This number one. Number two is about the disease. I think we could not differentiate between the respiratory disease, bird flu, or pneumonia. We could not separate, or disease. Number two. Number three, effective of the Tamiflu could only the first 3 days effective. And so you will see that, and also the number four is our Cambodia culture. Villagers, when they get sick, usually they are not access to the doctor. They just try to buy medicine by themselves, and then already past 3 days, you see, and effective of the medicine only first 3 days. And then when they get severe, and then they just, the parent will refer them to the hospital. So that's sometimes quite late, too late. And so that's why that in the policy of the Ministry of Health, we encourage the health center and the hospital to provide the treatment Tamiflu as soon as possible after you suspect, before after you collect sample. So that's why that the last several cases, children, they are recovered. Just last yesterday, we have a new recover of one,
Wow.
14, the 16 case, she is recovered, and also the 15 case also recovered. I think the 14 case also recovered. So, so as soon as if the villagers, they access to the public facility, they will more chance to survive. And I would say also that currently the government procure plenty of the Tamiflu, and also the lab equipment to collect sample to the national laboratory to test. Why I keep saying the national hospital has national laboratory? Because number one, I think that as soon as they suspect have to send as soon to national lab. If we waiting at the province lab or regional lab, they are waiting each other, you know. So then as soon I send to Pasteur and NIPH as soon as possible. Because, you know, we could get the result within 5 hours, very soon. And my country is small country, not big country. So we could send within 24 hours everywhere to our national lab. So that's why I focus. So this is the reason that why we have the high the cash fatality rate. So now we really need the assistant to communicate, inform, or educate our community. You know, when they show any respiratory symptom, they should access to the proper hospital or health center to get treatment as soon as possible with Tamiflu or any other disease as soon as possible. Thank you.
Thanks, Sovan. Yeah, so we have Sovan gets the test, he sends it to Eric. We've got the whole process here. Becky.
Hi, I'm Rebecca Ratcliffe. I'm a journalist from The Guardian and also a board member here at the FCCT. I'm curious about the situation in Thailand, and I wondered, you know, are cases going unreported, undetected here? What's your sense of the level of risk in Thailand and the situation here?
Do you want to try that, Volatility?
Anyone from Thailand here? Actually, I mean, from my experience and the information, Thailand, they implement quite interesting measure for the poultry. They have these different biosecurity measures, and they oblige it to have. I think my understanding is there are 4 levels of these measures applying in different type of this poultry. It's like commercial one, of course, they should be very high level, but however, they have is the implementing this good practice and standards in this backyard and you know, medium size of the poultry. That's the also we can see there is a lot of you know, the good how to say, not really see it is the disease is circulating in the farm. Is it enough?
Did that answer your question? Eric or Sovan, do you have anything to add to Thailand's processes to detect? I'm guessing not. I'm going to take that as a no. Do you want to ask the next question?
Sure. Hi, I'm Gloria Dickey. I'm a freelance journalist. You mentioned that the strain that's circulating in Cambodia is different from the H5N1 strain that we've seen hit wildlife populations throughout Antarctica and other parts of the world. I'm curious what threat this strain poses to wild bird populations and what kind of surveillance is being done there in Cambodia. Thank you.
Eric, do you want to try that question?
Sure. I mean, there is a good amount of wild bird surveillance ongoing within the Greater Mekong sub-region, right? So let's not forget that this is not a Cambodia-specific problem. Like, there's a lot of things that are going on in Vietnam and Laos, and really trying to monitor what's going on in the region. The issue is that, you know, wild birds are difficult to catch. It's not easy to do surveillance in wild birds a lot. You have to get mist nets. You have to be out in the wild. You know, you have to have the right trained personnel. And a lot of countries don't have the ability to do that sort of on a countrywide scale. In Cambodia and other places in the region, there are efforts to do this in an environmental way and things like that. But the ability to track, you know, we're not seeing, you know, wild birds fall out of the sky and things like that, if that's what you're asking. The 2344B virus is quite interesting because, you know, it's kind of gone from this concept of dead birds don't fly to dead bird flying, right? And it's spread quite quickly around the world. Whereas this 2321E virus here in the region, it may be outcompeting the 2344B virus in poultry populations and things like that. but we don't exactly know what the spillback potential is to, say, a wild bird population. And it may not even be getting close to those wild bird populations because they're in different areas. So these are all areas that we need to investigate more, and obviously hope that funders invest more money in around the region, as well as, throughout Southeast Asia as well. And then I can potentially give you more information.
So thank you very much for organizing this very informative workshop. So I'm Dr. Nozaki, working for JICA as the expert for establishment of the ASEAN Center for Disease Control. And then I used to work in Cambodia and very much interested in the presentation. So my interest is going to the animal sector. So almost similar to the previous question. So I'm interested in the exposure to the human. So do you see any similar trend in the chicken and the other animals about H5N1 infection or outbreak? Because I rarely see the statistics for the animal sector when I was working in Cambodia. So if you have any statistics that can show after the 10 years silence, we see many sporadic cases among the human. Thank you very much.
Do you want to try that?
Maybe Cambodia.
Yeah, does anyone have any statistics on how many birds are infected in Cambodia? So Van or Eric, do they exist?
Yeah, I think so. There are many detected of I would say about 30 events detected for the positive of the H5N1. And now I think I would say that now we are working better and better, because even sometimes if for the effective response to anything, we should have good coordination and good collaboration. This is just a term very easy to say, but the question how you have a good coordination and good collaboration. For me, simple reply, like me and Eric, we are friends. We make friends. We could kiss anytime, become friends, so that we have to work together like a friend, so that we do not have the obstacle of the bureaucracy and the hierarchy. So I would suggest that everybody who is responsible for emergency, for the good coordination and good collaboration, mean that we make friends. So that now we are better work with animal health. They share more and more with us. Even we are negative, we don't see the in-case transmission to human yet, but we work together to respond. And now, fortunately, also we just got support from the pandemic fund. It's our One Health Fund from for the animal health, for human health, and environment. Hope that we will do better. And one thing I keep saying it again: transparency, make friends, and information-based surveillance. And three pillars have to work closely together. Three pillars, key pillars, is laboratory, epidemiology, and clinicians. Encourage clinicians to send, because everything starting point is from the patient. Patient go to clinicians. My department is communicable disease, but I would say that 70% of the detection of outbreak is not communicable disease. It's foodborne, methanol poisoning, fish poisoning, and just last week we had a mushroom poisoning. So our system could detect any emergency. We call that, if we would like to implement to have a good and better health security, we are not saying communicable disease, non-communicable disease, foodborne disease. We say health security surveillance. Thank you.
Thanks, Sovan. I know Eric has to go in about 5 minutes, and I can see 2 people up there waiting for questions. So to make sure we can get his input, if you both want to ask your questions, and then we'll put them to the whole panel afterwards. Please go ahead.
Hi, Stay Leopold, University of Oxford. I'm a doctor. I work here in Thailand, and we do clinical trials on treatments for influenza, COVID-19, RSV. And we recruit patients here in nearby hospitals. So what we do is we screen them with rapid tests. And these rapid tests, they play a major role so during the COVID-19 pandemic, because many people would do them themselves. But sometimes I wonder, do we actually detect H5N1 with the commonly available, commercially available rapid tests? And that's actually a question to Eric. What's your thought on this?
Great. Thank you. That's a very good question. Hold that thought. And can we have our second question, and then we'll answer them both at the same time.
My name is Rob Atkinson. I'm the Agriculture Counsellor at the Australian Embassy here in Bangkok. It's been clear that, hello Eric, it's been clear that responding effectively needs a lot of technical capacity. And as you stated, this is not just a Cambodia problem, so it also requires a lot of regional collaboration. I think it's fair to say recently we've seen a decrease in funding internationally for technical capacity building and for international organisations. So I was just interested in reflections from anyone on the panel on whether you've seen a practical impact flow through from that on your ability to address the threat of bird flu. Thank you.
Thank you. So I'm going to turn to Eric first to answer both those questions, and then we'll get input from Sovan and Bolita afterwards. So Eric, can you detect bird flu with rapid tests, and what's the impact of funding restrictions?
Sure. First of all, hi Rob, good to see you. Rapid tests. Let's talk about rapid tests for a minute. Rapid tests are a really good tool, right? Especially during COVID-19 and then in clinics. I mean, we have rapid tests for SARS-CoV-2, we have it for RSV, we have it for flu A, we have them for dengue, arboviruses, lots of things. And they allow clinicians and you know, people like Dr. Savan's team and other people to make decisions very rapidly, and they're very critical. And that technology improves every year, okay? Of course, at the current time, the tests that we have, rapid tests, and we saw this during the COVID-19 pandemic and other places, they're not as sensitive and they're not as specific as, say, a PCR or this, you know, molecular-based tests that we have as a gold standard. And that's understandable because they're meant to be rapid, they're meant to be used in the field, they're meant to be used for quick decisions clinically. And I agree that having tests that can pick up H5 are absolutely critical. There's a number of people around the world, myself included. I help run international studies on these things through WHO, through WOA, through FAO, to understand the different viruses that are circulating, but also whether or not our rapid tests will work. Certain companies do work, certain ones don't. And then, you know, a lot of times these rapid tests are just meant to tell us flu A. That could be human seasonal flu A, or it could be avian flu. So we really need good tests, and I've been encouraging companies to make these things that are, you know, really specific to H5, to different types of H5. And there's a lot of companies that are listening. So I'm really hoping these products will be on the market, you know, within a half year or a year, that will allow doctors to quickly run these kinds of rapid tests, and we can quickly understand what's going on. Because we do fear that we're missing things. And we hope that we're not, but the ability to look at those very quickly is absolutely critical. On the other hand, the question about funding, that affects everyone, right? Funding is affecting everyone, from research to surveillance to policy. We need to develop more sustainable, more ingrained surveillance systems where we're not overlapping, we are supporting each other, where different countries are helping to support other countries and have cross-border communication and surveillance systems. We're using more rapid, more cheap, more faster, more better surveillance tools. We're making decisions faster, and that may just be the reality of the world for a long time now, that we've kind of reset, and we need to figure out how sustainable surveillance will happen. And I hope that we can all come together in a One Health manner and understand that humans and animals and the environment are all equal, and that we can all work together and play together on an equal level playing field. And that, you know, humans, of course we're humans, we put ourselves first, but that doesn't mean that the food that we eat and the animals that we take care of and the environment that we live in is any less important. So I think that will help alleviate these funding decisions if you know, it's One Health, one wallet, and really allow people to work together to make a sustainable system. Thank you much.
Eric, before we let you leave and continue your work in Singapore, are there any final thoughts from the discussions that you want to add? And then we've got a few more questions that we'll continue to ask Sovan and Bolita. Yeah, have you got any final closing thoughts about the subject?
I have lots of final thoughts, of course. But I think the main point of this is that the faster you can respond and the faster you can detect, the faster you can get ahead of everything. And I think Cambodia has done an amazing job with Savan and the National Public Health Laboratories and the Animal Health Laboratories, and really using what they've known from avian influenza. They used it quite well with COVID. They're using it again quite well now with cases of H5. And I think it's absolutely commendable. And I think we can't let necessarily politics and economics and all that kind of stuff get in the way of response. And we need to be able to move fast, as Savan says. So, you know, the more we can invest in new technologies, the more we can invest in trained workforce to respond, the more we can invest in rapid response in the 717 principle, things like that. I think the better will be for the next pandemic, because it's not really if there will be another pandemic, it's when. And it may be flu, but it may be something completely different. And we just have to be ready. Thank you.
Thanks, Eric. We'll let you go. But I think that it's worth sticking with the funding for a moment. Bolita, have you seen, when in your work for World Organization for Animal Health and from kind of a regional perspective, the funding cuts of the question, is that something that's also affected your work, and how are you seeing that manifest across Southeast Asia?
Yes, of course, and we always very closely collaborating with our partners and resources, particularly for the Southeast Asia. Currently, we have a project with Indonesia, and we are working with Indonesia for this laboratory diagnostic capacity. That's the twinning project with, and also we are very closely working with ACDP. ACDP is Australian AC Center for Disease Preparedness, and they have a worldwide reference lab and for HPAI, and we have very closely working with them. Of course, there's a number of these, you know, the technical capacity building for these our member countries, and also our Asia Pacific region. This office is located in Japan, and we are very closely working with Japan and also Korea. Of course, they have also reference lab. Hokkaido University have the reference lab, and Korea has also another reference lab for the HPAI. And hold this at the international level and regional level. Of course, we want to be help our members to develop the capacity building to help them to prevent and control HPAI. There's a number of the projects going on there.
Have they been affected by the cuts?
Sorry?
Have they been affected by the reduced funding situation that we're seeing?
Of course, if you look at this, that's maybe if you give me this chance to ask the questions for Cambodia, I can do the last one, okay? And of course, if you look at those for other countries in Asia Pacific, have you seen this any human cases? And because they're always working with the members, and because the important thing is for us, we have to look at the source. You know, we have to be really work on the source, and veterinaries should be on the front line and try to detect this, sick chickens, and early detection, early response is the key point here. That's why we are working in many countries. And if you look at Indonesia, there is no cases are there. That's the one of these, and also then in other countries which we are working with these collaborative projects going on, and we can see there is, the poultry cases are not see much. That's maybe the one of this outcome of these projects, and also this we are working with members.
Thank you. We've got one more question.
Thank you very much. My name is Mahinda Senivaratna. I'm with the International Commission on Occupational Health. Sorry I missed your presentation, so my apologies if you have addressed this before. What I'd like to know is what measures are in place, especially in Cambodia and Thailand, but also in the region, to protect the workers in occupations who are most at risk from exposure to these viruses, and especially considering the ILO just put out code of practice on protecting from biological hazards. So I don't know if any of the speakers can.
So Van, do you want to tackle that? What's happening in Cambodia to protect the people who are most closely working with poultry? What sort of measures have you got in place in the country to deal with that?
This is incentive. We protect our friends work together. We take care of them, provide them the prophylaxis for the culling response measure for our colleague from animal health. And also we used to provide Tamiflu, but now the PPE to them also, but now they have their own funding so that they could have their own support by themselves, but we still supply them with medicine and treatment to our friend in animal health and environment. Maybe I come back to the question about what we should do better next about capacity. For the capacity, like I said earlier, our charity country, developed country has support our developing country a lot of the financial. You know, they support us for 30 years already. Since 2003, 20 years to 30 years. Now it's not the time about build capacity of training again and training and training and training again. Now is the time to exercise in the field. So that's why I try to challenge that. Even my colleague in Asian member state in ASEAN, I try to test by sharing information of H1N1. The purpose that I share on time within 1 hour, I would like to exercise that how they could deploy to help each other. For example, in case Cambodia, they should come and then investigate together. What happened on the H1N1 in Cambodia? How to find a way how to stop if in case only happened in Cambodia, how to stop it. Mean that I really would like to exercise. We have to focus on fieldwork. We need to have financial, emergency financial mechanism, emergency logistic mechanism, emergency human deploy mechanism to deploy anytime, to release anytime of logistic, deploy anytime of human, release anytime of the emergency financial to support the fieldwork. This have to change from the training, because I really worry that many partners will provide funding, but we overlap of the working. WHO have trained a lot. And why we train again? Yeah, we train 30 years already is enough. It's the time to field work. So that's why in Cambodia we exercise to the field work. I even could detect the patient with the poisoning of the mushroom, fish, you know, vector-borne disease from the climate change, because we really exercise now to prepare for, to stop the source of the outbreak. This is number one, I would say. Number two, we have to change the behavior of the sharing information, not sharing data. Data too late, and data is very sensitive. Data is about the privacy. So that it's not the time to share data. When I attend internationally, I just come back from ECDC from Sweden also. I talking about many times about sharing data. Data is too late, and privacy will not share. If share is official, what we could share is information. We could share an informal information, so that we could get the response, early detection and early response. And another one is about the bureaucracy and hierarchy. We have to change our behavior, you know, for the emergency. If we are not changed, our will still at risk, still at risk. So these are my final word. Thank you very much.
Thank you. That was a great way to end, actually, Sovan. We haven't got any more questions, so Bolatuya, is there any other final reflections or points we haven't discussed that you think could end our session, and then hopefully people will stay around for a drink and a conversation afterwards?
Thank you. Thank you for that. Actually, I have a question.
Go.
Is that,
ask a question. Sovan, we need you back.
Thank you very much giving me this opportunity to ask a question, because we are just, I'm not working in the Cambodia, and I don't know what's the difficult situation and why this, we have this fatality rate is quite high, and people get sick. And I have as a question, Dr. Sawan, that what do you think, why Cambodia has the human cases? And because also, if you're looking at the similarity of the other Southeast Asian countries, we have the same poultry sectors, and they have backyard chickens, they have a different commercial farmers. But do you see what's the key gap, in Cambodia, and also might be helpful for us how we can support Cambodia as well?
Sovan, over to you.
What we need now is the risk compression. We need support awareness our villagers, both in human case and animal health. Encourage them to report any chicken death and human suspect access to the proper hospital as soon as possible. Like I mentioned, the Tamiflu treatment effective only 3 days, and usually our villager behavior still, they when they sick, they still access their own to the drug seller. In Cambodia, the access the drug seller still popular. They could access to buy the medicine by themselves. So that the first 3 days sick, usually they go to drug seller until that they could not treat by themselves, and then they go to the hospital late. And effective of the medicine also could effective only the first 3 days. So we really need the recompression. So that's why I work with WHO and all partners whenever they come to meet with me. Please support, because the IEC material that we develop, like bird flu, the children in the TB spot, now they have some of them, like one woman, they have one girl, they have 2 children already. But I still post that TB spot to the to the social media. So we really need the recompression, like especially the TB spot, to educate our public, both animal health and human health. Thank you.
Thanks, Sovan. Great. Well, I think we'll wrap up there. It's been a really interesting conversation. Thank you all. I hope people will stay around for a chat and a drink afterwards. But thank you for coming. And yeah, we'll close the event there. Thank you.